Okay, so here we're going to demonstrate the flexibility of the low back and the hamstrings, more specifically towards the spine and the hip joint. Before you begin, we can do a short, moderate intensity aerobic exercise with some flexibility involved. We can do either some high knees, we could either do some jumping jacks. For the stretches, you can do some static stretching. For example, you could do a modified hurler stretch. Another thing you can also do is some dynamic stretching, but here you want to do it with caution because anything that involves fast and jerky movements should be avoided before this exercise. Okay, so before you begin, you want to make sure you have your client take their shoes completely off. You want to have their feet flat up against the platform of the sit and reach box at the 26 centimeter mark. The box we're using is 23 centimeters, so we'll talk about the conversions and what we need to do for the scores later after the video. Also, their inner soles of their feet, you want to make sure that they're within 2 centimeters apart within the measuring scale. So as your client goes out for the stretch position, you want to make sure that their hands are either parallel with one another or you can have them overlap each other as well. But you want to make sure that one does not lead with the other hand. As they go out for the stretch position, you can have their head down in between their arms, and as they go out as far as they can, you want to have your client exhale. Once they get to the farthest position possible, have them hold that for 2 seconds. Okay, so I'm just going to replay the video. Another important thing you want to make sure is that your client's legs are extended at all times, but you don't want anyone pressing down on them. Your score is going to be the most distant point recorded at their fingertips, and it's going to be the best of 2 trials. Now, for best scores possible, you want to make sure that your subject doesn't hold their breath at any time. You want to make sure that they do breathe normally. Now, this kind of test can be modified for young, older, and pregnant populations. However, the scores are based off the norms between ages 20 and 69 for both men and women. Once you get your results, you do want to convert it to centimeters if the box you're using only has inches. Now, from there, you can relate it to what fitness category they fall into depending on their age and gender. Now, because we're using a platform with the 23 centimeter mark and not a 26 centimeter, all you need to do is get their value and subtract 3 centimeters from that, and that'll give you what fitness category they fall into. So just like the video that we just demonstrated, you want to make sure you do have your subject do a 5-minute warm-up. This could be a moderate intensity aerobic exercise with some stretching involved. You could either again do some static stretching or dynamic, but keep in mind to avoid fast and jerky movements as this should be avoided before doing this test as well. Okay, so similar to the video that we just demonstrated, here we're going to do the YMCA sit and reach test. This test is different because the only thing we'll need is a yardstick, some tape, and a mat. Another thing that is different is that this test is designed for 18-year-old male and females and older. Uh, okay, so first thing you want to do is go ahead and grab a piece of tape and mark it at least 10 to 12 inches apart. This will give you an idea of where you want your subject's heels to be when they perform the stretch. Another thing you want to do is go ahead and grab the yardstick and place it in between the two tape measurements between 10 and 12 inches, and actually grab a piece of tape and place it over the 15-inch mark. One that'll make a right angle and another it'll prevent it from moving. So this is where you want your subject's heels to be. You want your subject's heels at the tape line. You want to make sure that their legs are fully extended and you do not want anyone to press down on them. As they reach forward, you want to make sure that they do drop their head in between their arms and exhale on the way down, breathing normally at all times. Now, as they go out and stretch, one thing as you can see here, you want to make sure that they actually do touch the meter stick and hold that position for 2 seconds. Again, you want them breathing normally. You do not want them holding their breath at all. Similar to the video again, it's going to be the best of 2 trials and it's going to be recorded in inches. Alright guys, so one thing I didn't mention but you can clearly see in the video is that you do want the yardstick in between your subject's legs. Another thing I didn't mention about the hand position is similar to the previous video, you want them either overlapped of one another or parallel, but as they go out and extend, you do not you want to make sure that your subject does not lead with one another. Just like the other video, the recording is going to be the most distant point reached on the yardstick. Once you get your recording of the best of 2 trials, you can then relate it to what fitness category they fall into depending on their age and sex. Our subject was able to reach out to 19 inches. This would place them at the 80th percentile above average for males for ages between 26 and 35. Okay, so here on the straight leg raise test, we're going to go ahead and test out the flexibility of the hip extensors and the hamstrings. Now, this is of great interest to know because if there is an imbalance between the two, it can have a negative effect on our lower back. Now, this is going to be considered a passive range of motion stretch. Reason being is because we're going to have our tester assist our client on stretching out their hamstring as far as they can go. Now, the only thing we'll need is a goniometer. This type of tool is used in therapy clinics and rehab facilities. This will let therapists know what if there is an imbalance on a particular joint or range of motion for the client. Now, before you begin the exercise, you just want to go ahead and make sure that you do have a flat surface or mat that your subject can lay on. You want to make sure that they do lie in a supine position on their back with no arc on their back at all. You want to make sure it is flat against the surface. So one thing you want to do is go ahead and place the axis of the goniometer at the greater trochanter of the femur. Now, you want to go ahead and make sure you have your tester stretch the hamstring as far as they can go and test it on both sides. Keep in mind, since we're using a goniometer, it's going to be recorded in degrees. Anything below 80 degrees is bad. 80 is going to be acceptable, but 90 degrees is desirable. Alright, so once we find out what their range of motion is, we can then present it to our client and let them know if it's acceptable or unacceptable. Depending on what their range of motion is, if it needs improvement, we could then provide an exercise program to improve their range of motion. Alright, so this is very similar to the previous test described. This is still going to go ahead and test out the flexibility of the hamstrings and the lower spine, particularly at the hip joint. Um, Now, this test is a little different because it's more designed for an elderly population for both men and women above the age of 60. Reason being is because we're only going to be testing out one leg instead of two. Another thing is we're going to be using a chair. Elderly populations may have limited range of motion, so they may be unable to get up off of the floor if they're going to be doing the YMCA test or the sit and reach one. Now, for the chair, you want to make sure it's a folding chair that's stable enough to keep from leaning forward, as we're going to have our subject sit at the very edge of the seat. Another thing, you want to make sure it's at least 17 inches in height. And another thing that you will need is either a 18-inch ruler or half a yardstick so that we can take our measurements. All right, so one thing about the form, you want to make sure that the untested leg is going to be completely planted on the ground. You want to make sure that that foot is going to be at least 6 to 12 inches away from midline of the body. Now for the limb that is going to be tested, you want to make sure that their heel is completely on the ground, dorsiflex at about a 90-degree angle. Now let's go ahead and demonstrate the exercise. So as they reach forward, you want to make sure, of course, that you want to have them exhale with their hands either overlapped or parallel, and make sure that they do not lead with one another as well. You want to make sure that their legs do not bend. You want to make sure that they are extended at all times with no assistance being pressed down on them as well. Um, so as they reach forward, the goal is to essentially go ahead and touch their toes. Now, as they reach out as far as they can, you want to make sure they hold that position for at least 2 seconds. Okay, so another thing about the form is that you do want to make sure that their palms are facing down towards the ground. Now, as they're bending at the hip joint, you want to make sure that their back is straight at all times, and you want to make sure that their head is properly aligned with their spine. So this means that you do want to make sure that their head is not tucked in. Now, as they reach forward, you want to make sure that they bend over slowly. Again, holding that position for about 2 seconds as far as they can go. Now, the thing about the ruler positioning is that you do want it parallel with their leg. One thing about the scoring is that the middle of the big toe is going to be considered a 0 point. So if they're able to go beyond the big toe, that's going to be considered a positive value, and you would add the numbers and you would round it to the nearest half inch. Now, if they're unable to make it to their big toe, you would just subtract the difference. So if they're about 3 centimeters away from reaching their big toe, that would be negative 3 centimeters or to the nearest half inch. Now, before you begin the exercise or test, you want to make sure you do a practice run, and then you go do a practice run twice, and then you want to go ahead and do your recording one on each leg. Once you get your results, you can then let your client know what fitness category they fall into.